Weight loss has been a major talking point lately, especially with weight loss injections dominating the headlines. While much of the conversation focuses on the numbers and the scales, far less attention is given to the emotional impact of weight, both on a personal level and in terms of how society shapes our self-worth based on body size. One important issue that deserves more discussion is internalized weight bias, when a person takes in negative societal stereotypes and beliefs about body weight and applies them to themselves. It's the process of absorbing the discrimination and judgments you see and hear from media, doctors, family and friends, and making those biases your own. Dr Stephanie de Giorgio, a GP, weight loss specialist, and co-founder of Genwell Health, is on a mission to change how we think about weight, helping us see ourselves more positively and treat ourselves with compassion. My name's Victoria, and I recently sat down with Stephanie to talk about what internalized weight bias really means, how it affects those who experience it, the signs to look out for, and simple ways we can support ourselves and others in breaking free from it. Hi Stephanie, it's great to have you here today. This is such an important topic, and I know it's something you're really passionate about, given your expertise in weight management and also your personal experience with weight loss. So for those who might not be familiar, can you share in your own words what internalized weight bias actually is?
This is a fascinating one because I can pretty much guarantee you that anyone who lives with obesity or overweight knows exactly what internalized weight bias is, but has probably never heard it called that unless they have been doing reading or research. So societal weight stigma is what society, everybody else, thinks about people who live with overweight and obesity. Internalized weight bias is the negative inner monologue that sits in the heads of people who are living with overweight and obesity and takes up so much brain space. And it's something people unfortunately have a lot, and they use it to influence decisions that they might make about themselves. And also, unfortunately, is something that will mean that they think less of themselves and blame their weight for so many things that happens to them. So it's an inner feeling, an inner monologue, and is generally something that is very, very negative and difficult to live with.
What are some of the main psychological and physical effects someone might experience when they take on those negative beliefs about their weight?
So that monologue that I was talking about, that inner monologue, will mean that people think less about themselves and they will blame themselves. And the blame and the guilt is a huge part of it. And we know that having obesity and overweight leads to higher rates of anxiety and depression. And so it's not that that's guaranteed in any way. It's not that someone is definitely going to get that, but we know that that can happen. And we know that people will also try and sort of get there first if they're in a conversation about weight with somebody. So they'll make comments about themselves being overweight to sort of stop someone else getting there first. Or they'll try and be the really funny one. It's there as a stereotype for a reason, the funny fat person, and that happens. So people will try to head it off in a conversation. And that's tough. That's tough because if you're feeling horrible about yourself and then you're trying to make other people not say horrible things, that's difficult. So you can understand how that psychological effects can happen. And so people will be very down on themselves. They'll be very not believing they're worthy of love, or not believing they're worthy of someone's time or a job application or something like that. So psychologically, that takes a toll. And it will mean people sometimes become quite isolated. They might not want to go out very much. They might not want to go, certainly things like going to a gym, that kind of thing is really difficult. And it's because of what other people do, but people stop themselves even before they go because they think that something will happen. They think they shouldn't be there. They don't have a place there because they live in a bigger body. And that's awful. And the physical effects that come with that are stress, anxiety, so higher levels of the stress hormones that go on, which have all sorts of other problems for people. In terms of that physical isolation, they might not go out very much. They might stay at home. So it has a huge effect on people's well-being. And it's a really horrible thing that happens to people because of how they feel about themselves.
Can a person have internalized weight bias even if they're not clinically overweight or don't have what people might think of as a larger body?
This is really interesting. And yes, absolutely, particularly for people who have lived in a bigger body and then may have lost some weight. And that feeling of negativity about themselves, about them not being worthy of love or worthy of a job or worthy of people's time, and that they constantly fail because they can't control what they're eating, that kind of thing, that sticks. And it's lovely once it goes, and it does eventually go, but it sticks. So it can be there for quite a long time. I don't think it's been there for people who've never had a bigger body weight because they haven't had the stigma from everything else kind of thrown at them. But I think we all have different thresholds for it. And so there will be people for whom that kicks in, perhaps at a lower body weight than for someone who is bigger. And that probably has relationships to somebody's inner sort of self-worth and self-belief. And so somebody could get to quite a much larger size body and still not struggle with the same thing, whereas someone who's put on a few pounds might suffer from it earlier. So yes, we have to hear it if people are telling us that they feel it, even if to us we might think, yeah, but you're really not very big. We still have to hear it and acknowledge it and validate it and then help them with it.
Could you walk us through what the weight loss internalization scale is, how it works, and how health professionals might use it with their patients or clients?
So the weight loss internalization scale is trying to sort of measure how much this is affecting somebody. I, interestingly, haven't used it ever, but it can be used perhaps in specialized weight management services where someone may want to formalize with a number how affected somebody is. Personally, as a clinician, I prefer to chat through this stuff with somebody. I'm not a huge fan of scores for lots of different mental health things. I don't tend to use them, but it's a validated score. People use it. And so if someone came across it, they shouldn't be surprised that someone is trying to find out how affected they are. And as long as it's done in a therapeutic and sensitive way, that's great, because the questions are questions that are tough. They're tough things to read, tough things to hear. And so I'm always very keen that if anyone uses a score, they do it as a framework for a discussion, not handing someone a piece of paper to tick the boxes, because then you're leaving someone with an open-ended, horrible feeling. And I don't like that much. So as part of a therapeutic conversation, I think that's fine.
For someone just starting to think about this, what's a good first step to becoming more aware of internalized weight bias and managing the way it influences their thoughts and actions?
I think the first step, the absolute first step, is to know that having overweight and obesity isn't their fault. So before I had my weight loss surgery, this negative inner weight bias took up, I would say, probably 80% of my brain space. You know, if I went out for a meal, all I could think about was, why did I choose that food and not the kale and quinoa option? And then I'd go home and feel bad about it. I think I didn't get a job because I was bigger. All of those horrible, horrible things. And it's pernicious and it sits. So everyone will know they've got it. What they might not know is that it's not normal. It's not healthy. It's not a good thing for your brain. It's your brain reacting to what society has done. And so knowing that having obesity and overweight is not your fault is like the first step in then saying, right, so if it's not my fault, why am I beating myself up over it? And there's a whole host of reasons for that, which are things that I'm working on all the time to try and change stigma and change belief. But once you have made that connection that this is not what everybody has, not everybody in the world thinks this about themselves, then you can say, right, okay, perhaps I need to be a bit kinder to myself. Perhaps I need to understand that I am not a failure. I am not someone who is weak-willed. I am not greedy. I am someone who is deserving of all the nice things that everybody else in the world has. And so then I think it needs professional help quite a lot, to be honest. I think it's a really hard thing to turn around yourself. But I'm a huge believer in compassion-based therapy, so self-compassion. And there's lots of stuff people can read about that and learn about that. And I think it's learning that you are worthy of all those things. And you might have not thought you were worthy of those things since you were a kid if you've had a lifelong weight battle. And slowly, whatever your body size, knowing that you are perfect and deserving of love. And so then that might need professional help. It might be that something people can read. It might be that people have an ability to chat with someone else about it. The problem is once you have that thought and those thought processes, you're still getting the negative messages from the world. That's why I think sometimes professional help is necessary, because it's quite a big thing to fight off. If you have lost weight, if you've lost weight and it starts to go and you feel free of it, that's amazing. If weight regain occurs, it comes back in bucket loads. And that's really tough, because then you feel that somehow you've failed even more than you had before. And most people who have overweight and obesity have lost weight, regained weight, lost weight, regained weight. It's that yo-yo dieting thing. It's not because they've failed. It's because of physiology. It's because that's what our bodies do when we lose weight. They want it to get back to where we were. And it's not a failure. But that feeling of failure comes back because you feel that you should have stayed a lower body weight. And that's simply going against nature. And it's only about 7% of people who manage that. So it's so important that people reach out to people who understand this. And that may be a professional. It may be someone else who's been through a weight journey. But I think knowing that it's not your fault is such a powerful thing. That's the thing you have to embed. And then everything else can work around that.
And how can health professionals, such as dietitians or doctors, help patients recognise and move past internalized weight bias? And on the flip side, are there any things they should steer clear of to keep the environment supportive and non-judgmental?
There is a massive role for health professionals here. And I actually not just include things like dietitians, doctors. I'm going to put in physios. I'm going to put in occupational therapists. I'm going to put in surgeons, metabolic bariatric surgeons. I'm going to put in people who work in the fitness industry. I'm going to put all of those people in. Anybody who is perceived to have knowledge that somebody with overweight or obesity is going to for help needs to understand this, and they need to understand it really quite fundamentally. So the first thing that people can do, and the first thing that I always tell GPs that I teach, is that they need to ask permission to discuss weight. Now that feels really odd, perhaps, but it's now in the NICE guidelines, which has made me so happy. So the reason for that is that you are acknowledging that previous healthcare interactions may not have been great. And you are also acknowledging that for a person, this is not like discussing, I don't know, the colour of their snot or something if they've got a cold. This is discussing something incredibly difficult. So asking permission and accepting for the answer to be no is the first step. So that's important. If someone says no, then what I will always say is, that's absolutely fine. That is your right. That's okay. Just know that the door is open if you want to come back, and we will have a discussion that I hope will be very different to any discussion you've had before. So that's the first thing. The second thing is then acknowledging that people might have had difficult discussions before, and that those discussions might have fed the internalized weight bias. Because if somebody tells you, well, your knees are because you're fat, so they're not going to stop hurting until you lose weight, or gosh, you looked slimmer last time, you'd lost loads of weight and you seem to have put something back on. Those kind of little judgmenty things are massive. So if instead of that, we say, we know that living with overweight and obesity can be hard. And we know that sometimes people take in what society says about them. And that can lead to difficult feelings. And I want you to know that it's not your fault and that this is normal. That can be the most freeing thing you will ever say to a patient with overweight or obesity. They will leave your room feeling 10 times happier simply for knowing that they haven't failed. They haven't lacked willpower. They haven't been greedy and gluttonous and lazy. They have a condition that has caused this to happen. So if you do that, you have set a scene for an open and honest conversation where somebody is going to trust you. And that's hugely important. And I will also say that it's hugely important if you're looking after a child who may have overweight and obesity, because the parents will bring the child's inner weight bias with them and the child will have their own. And I actually think in many ways that's a discussion that, unless you're quite skilled, you have to be very, very careful of. So I think once you have recognized it, you've named it, name that this is a thing, name that healthcare professionals can sometimes make it worse, then you can start to say, right, now you know this isn't your fault. Now you know that this is physiology, and explain some of the science to them. Explain why keeping weight off is difficult. Explain why they might have been doing this for years and years and years. Explain why weight problems might run in their family. Everyone might have overweight and obesity. So do all of those things. And then you have started the person on a journey to making sure that they understand that the problem isn't them. And then you have enabled a therapeutic discussion. I think one of the other things that it's really important for anyone professional who is being sought for help for problems with people who have overweight and obesity is to make sure that their surroundings are good. So again, I'll give you an example. When I was bigger, I had gallstones. I'm a GP. At that point, I'd been a GP for many, many years. But because of my negative inner weight bias, I thought that my tummy pain was because I was greedy and eating too much. So I didn't go to the doctors. I would sit in bed, writhing around with pain, which in anybody else, I would have gone, duh, it's gallstones. I sat there going, Stephanie, you've eaten too much again, you stupid woman. Why did you do that? If only you hadn't eaten that. And part of the problem was that every time I went to the GP, he would make me stand on the scales. And I, in the end, said, I'm not standing on the scales. I know that I'm fat. I know that I'm fatter than I was last time I came to see you. That is not new knowledge to me. And you making me stand on the scales is not making me suddenly go, gosh, I didn't know I had a problem. And so because I had been dealing with that and the fact that he would sort of get the bigger blood pressure cuff out and sort of make a deal of putting it on the machine, meant that I didn't feel I could go to him with this. And it wasn't until someone else was my doctor and I went in and I went, my tummy really hurts. And they went, well, yeah, gallstones, duh. And I thought, oh Lord. And I felt stupid. 2 years that was. And that is the example of how powerful negative inner weight bias is. So I've told that story, not to make people feel sorry for me, but to show the absolute strength of conviction that someone can have that the problem is them. And one of the issues with that is it causes something called diagnostic overshadowing, which we can do to ourselves and doctors can do to us. So it means I had put clearly symptoms of gallstones down to being fat. And I have learned lots of other cases of doctors putting serious problems down to somebody having overweight and obesity when actually it was cancer or it was something else. And that causes deaths. So we need to be absolutely certain as healthcare professionals that we make sure we don't allow diagnostic overshadowing to come into the equation. Someone with overweight and obesity is allowed to have exactly the same level of care as somebody who doesn't. So take the same time and attention. Make sure that the environment around people is appropriate. So if you always put the large blood pressure cuff on the machine in a sort of, if you have a couch for smear tests that isn't able to have people of higher body weight on it, get a new one. We now know that having overweight and obesity is more common in the age group of people who need smear tests than it's not. So it is no excuse to not have a couch for people of higher body weight. Yes, you might only have one because it might cost a lot to buy, but make that the place where people have their smears. And if you know someone's coming in, you just, no question, you just go to that room. It's not a biggie. Make sure that you've got the kit that they need. Make sure you have scales that can weigh people and of higher body weight, so you don't have to kind of schlep or tell them to go up to the hospital to be weighed, or just all those little things. So make sure the environment is there. Make sure that as a clinician, you don't get diagnostic overshadowing in there. Don't let that happen. And make sure that you reassure the patient that perhaps having to go somewhere else or having to use different kit is not a big deal. This is just how it is. In the same way as someone with lower body weight might need something else. Just be that person and make sure that the environment around the patient is suitable for them, that they can sit in the chairs, that all the chairs don't have arms because they might not be able to fit in them. We have chairs with arms so that people who are older and frailer can push themselves up out of the chair. Why is that more important? It's not. So make sure that all of these things are really just there, just normal, and that environment is what people go into.
Thank you, Stephanie. And could you tell us, are there any particular kinds of therapy that you've found especially helpful for people dealing with internalized weight bias?
I think if someone's going for therapy about anything, it's really important to make sure that the therapist knows what they're talking about. Therapy, unfortunately, can be quite an unregulated industry. And so it's really important that somebody understands weight and obesity. And not many people do still. It's still not particularly understood. But a good therapist, even if that's not like a massive area of expertise for them, will understand negative inner monologues. People have them about lots of things. Weight is one of the things that people can have them about. And so what's really important is that the therapist uses whatever kind of therapy is going to be appropriate for that individual. And that's going to be different. I've already mentioned compassion-based therapy. So that might be part of it. That's really important. It may be cognitive analytical therapy. So the way that people think about themselves and the way that how things affect their thoughts. And that's different to cognitive behavioral therapy, which is about behaviors. And I think one of the things I want to say, and this is not to denigrate people who do cognitive behavioral therapy at all, but there has been a real push, particularly in the NHS, to consider cognitive behavioral therapy as the thing everybody needs. And it's very easy to end up having 6 sessions of CBT and then you'll be fine. That's not true. For lots of people, that's not true. And so I'm not an expert in lots of different kinds of therapy, but a good therapist will use whatever they feel is appropriate for the person in front of them. We know that lots of people with obesity may have quite significant childhood trauma, particularly young women with severe obesity. So what we call class 4 or class 5 obesity. They often have really significant childhood trauma, childhood sexual abuse, for example. And that's a specialist area that your average counsellor should probably not be delving into without a lot of experience. And so what I feel is really key is that somebody checks out their therapist. It's okay. Any good therapist will say, right, let's have a 15, 20-minute discussion and see if we like each other. And if you don't feel confident with me, I will not take it personally. You can never talk to me again, and that's absolutely fine. And that's what a good therapist does. A bad therapist will say, oh yeah, let's book you 6 sessions now. I'm not going to go into exactly what types of therapy because I think it is really different. I think compassion-based therapy is a really big thing, though. I do feel, however, that the most important thing is that the person works with somebody who they feel safe with, who they are able to divulge difficult stuff to, and who understands enough about obesity to show that they understand how it affects somebody and that how societal stigma affects somebody and therefore how their negative inner weight bias affects them. So That's the most important thing, is picking somebody and not being afraid to end a session and say, I'm not sure this is working for me. I'm going to go and find somebody else. Because most good therapists will say, that's fine. Don't worry. It's okay.
And finally, how do concepts such as body positivity or body neutrality fit into helping people work through and overcome internalized weight bias?
Oh, this is a big one for me. I think that negative inner weight bias is toxic. I think it is. What we have to remember is that it goes alongside societal weight bias and stigma. And those two things are really difficult to separate. Now, I said earlier, some people will have very different thresholds for starting to feel bad about their body weight. And there are some people who live in really big bodies who are like, yeah, this is cool. This is me. And happily do all the things in life and don't think about it. And that's great. And every single person in this world deserves to live stigma-free in whatever body size they choose. I'm all over that. That's brilliant. One of the problems that has occurred with the body positivity movement is that it has told people who live in bigger bodies that they don't need to feel bad about it. That bit's great, but it kind of forgot that they feel bad about themselves already and that societal stigma happens at the same time. So it's almost like saying to somebody, I know you feel like this, and I know that this happens, but just ignore it. Just ignore it, because living in a bigger body is perfectly fine. And some people with obesity are left feeling like they're failing something else. They're failing to feel happy about living in a bigger body because somebody in a bigger body is telling them to do that. And that is sort of denying your own feelings. And we all know that denying our own feelings doesn't make those feelings go away. It means that we then feel bad about having those feelings. And body positivity in one way can cause that. So that's a real problem. And that's very much, I suppose, at the more extreme end of the body positivity movement. For example, I have been subject to some quite difficult comments because I talk about weight loss. And there are some people in the body positivity movement who say we should never talk about weight loss because everyone deserves to live in their bigger body. Yes, absolutely. They absolutely deserve to live happily in that. But we also can't deny that living with overweight and obesity does have some health problems. And also that living in a bigger body can make going through the world more difficult. It is still not easy to get on a plane. It's still not easy to fit in some chairs. It's still not easy to do all of those things. And so we need to acknowledge that those two things can live beside each other. Everybody should be happy living in the body they live in, but at the same time knowing that having overweight and obesity can be bad for your health, and therefore people will want to lose weight. Those two things go alongside each other. The one thing that really matters is acknowledging the harm of societal weight stigma and the harm of inner weight bias, and knowing that in order to fix one and to diminish one, you have to diminish the other, because they come as a pairing. And we need to be very certain that we don't put all the emphasis on the person living with obesity to fix themselves, so to speak. And we all have a duty, including healthcare professionals, and I think even more as healthcare professionals, to educate about obesity and fight back against societal stigma so that people living with obesity don't develop such horrible feelings about themselves.